Coronavirus gets spread just like other viral respiratory infections. Whenever people have respiratory symptoms like coughing or sneezing, and they end up really making droplets in the air, and those droplets can land on different surfaces, sometimes on other people's bodies and skin, and that seems to be how it gets spread from person to person. The symptoms of this novel coronavirus infection are mainly respiratory. A lot of patients develop fever, and then they go on to develop some element of a problem breathing, maybe coughing, and sometimes they go on to have pneumonia. I think it's really important to note, though, that just like a lot of other respiratory illnesses, the vast majority of people have a very mild course. In fact, many of them, as soon as they get diagnosed, they get sent home to recover at home. That's at least been the experience in China, where we have the most information coming out about this disease at this time. So just a very small number of patients will actually need to be hospitalized, and an even smaller number end up having like a mortality. The vast majority of people, they may not even recognize that this is something new, because it will just feel like the common cold, or maybe just a couple of days of flu-like illness. The patient will be in airborne and contact precautions, and the staff will need to wear a gown, gloves, an N95 respirator, and eye protection like goggles or a face shield. And that's really going to be the procedure for interacting with these patients, and that's going to keep our workers safe and also protect the patients themselves. The PPE that's recommended, it really depends on what you're doing during your duties. For those that are taking care of patients that have respiratory illness, you'll know exactly what kind of PPE to use, because the person will have respiratory precautions, either airborne or droplet or some other precautions in place. And you should really just be following the guidelines for exactly what kind of isolation that patient is in. For patients that don't have any symptoms, they don't necessarily need to have any PPE that the clinical workers have to wear whenever you're interacting with them. So if a person is having chest pain, or if they have an orthopedic issue, or if they're having a baby and they don't have any other symptoms, then you don't really need to be worrying about wearing special PPE to protect yourself, because those patients have no risk of contracting or giving the coronavirus. We get a lot of questions about when you should wear a mask and when you shouldn't wear a mask. The guidance is that you should only wear a mask if you're caring for a patient that has respiratory symptoms. And in that case, the patient should either be in an isolation room or wearing a mask themselves. Outside of that, when you're just doing your general work, or if you're in the hallways or getting a meal at the cafeteria, you don't need to be wearing a mask unless you're actually in the proximity of a patient with respiratory illness. One of the things that happens with masks is, and you've probably experienced this yourself, you end up fiddling with it a lot. And that actually increases the amount of contact that you're making between your hands and your face. Because we know that some of these infections are transmitted by hand-to-face contact, that can ironically predispose you to having an increased risk of having the transmission of this virus. So in addition to wearing a mask, you really have to focus on how clean are your hands, and just be really obsessive about washing your hands all the time, and really washing them well, taking the time to scrub, sing yourself a happy birthday song every time you wash your hands so that you can get enough contact time with the soap, and really just make sure that you're practicing just kind of common sense good hand hygiene throughout your shift. Well, first remember, you really have to use the personal protective equipment when you're taking care of those patients. And if you're not sure exactly how to put those things on and how to use them, definitely work with your department, work with your supervisor, and practice doing it before we actually get some of these patients so that you feel very comfortable donning and doffing these garments and gowns and masks and goggles. Beyond that, once you're using the personal protective equipment the way that you're supposed to, you're extremely safe. Once you take those things off, once you end your shift, you're able to go home and just live your normal life the way that you usually do. No real special chemicals that are necessary whenever we're dealing with this novel coronavirus. We are going to ask everyone to be very mindful of making sure that surfaces and areas of patient contact and areas of staff contact are absolutely kept as clean as possible. But to be honest, we're doing that anyway. We do that all the time just to make sure that we're ready for things like influenza and other viruses and other bacteria. There's really no special chemicals or cleaning procedures that need to be done beyond just being really good at all the things that are already in place. I couldn't be more proud of the team that we have, and I can assure you with utmost confidence that we are totally ready at both of our hospital sites for something like the coronavirus. I know that there's a lot of unknowns. It's making the headlines. It's natural to feel some of that hype rubbing off whenever you read these headlines, but we're absolutely prepared. And I think a lot of the public health experts are thinking about this as just another type of influenza, almost like a super flu. And the way that we're going to get prepared and get through it is to make sure that we use all of the common sense lessons that we know about how to deal with influenza and apply them to this novel strain of virus. But everyone's ready. We're more than ready. If and when those patients start arriving, we will definitely be able to take care of them and get them better and protect ourselves at the same time.